Okay, so I guess from the very start, I would first like to say that I had a really great childhood, what I would like to consider normal, I guess. Like, I had two amazing parents. They did everything above and beyond for me. And then I graduated high school and I moved to New Mexico for college. Got in a relationship and I walked in on him one night smoking something, I don't know what it was. And he was like, oh, this is marijuana wax, you know, THC, do you want to try it? And I said, well, you know, I've smoked weed a couple times, I liked it, so yeah, I'll try it. So I smoked it and I was like, oh my gosh, like this is amazing. So we smoked it for the next couple days, and like the fourth or fifth day, he just broke down crying. And I was like, what's wrong? And he was like, that stuff that we've been smoking, it's not wax, it's heroin. And I was like, what? Just like a scene from a movie, you know. I packed all my stuff, I was yelling at him, I left, I went back to my apartment, and he showed up, and he was crying, and he was just begging, you know, to give him another chance, that he was gonna go to rehab, get help, you know, all this stuff. And I stayed with him, and it was just a snowball effect from there, so that's how I originally got started.
I became an addict at it was probably early high school. It was actually whenever I was going to the dentist, actually for my wisdom teeth, is what I believe started it, because the dentist was writing me a prescription for pain pills literally like weekly for almost a year straight. So after that, it was bad. I had a really bad addiction, and I got addicted to oxycodone. There you are, that's it, that's all you gotta do.
32 and a half.
Yay.
Inches. All done, you can go now.
See, that's it. Okay. That it was the most horrible feeling in the world just to be like sober. You know, it's crazy to sounds crazy, but it was. I just didn't feel normal. I felt out of body almost, but whenever I took the pain pills, I felt normal. And a lot of times whenever I would go to the doctor, I was classified as drug seeking, and you know what I'm saying, they wouldn't help me, and of course they looked down on me and they judged me and things like that.
Before I had my son, like, I was an IV heroin addict, and that took me to some really, really dark places. I ended up homeless and was selling myself for drugs. I had to go to treatment just to be able to get out of the environment. But when I finally was able to stop using and like had, you know, consecutive months of clean time, it was a miracle to me. And that's not what I saw reflected back to me from the hospital social worker or the DCFS worker. I felt almost like they didn't care to know how far I'd come or anything like that.
There was one time that I did actually overdose, and the doctor walks in. I don't know, maybe he was just over it, like he was sick of seeing so many people OD. And he's like, well, you died. And he's like, but I guess it could be worse. You should consider yourself lucky, because this isn't a situation where I have to come in here and tell your family that you're gonna be brain dead the rest of your life. I get it, and I'm sure you're sick of seeing it, but I mean, that approach is not gonna help anybody. That's just gonna do the complete opposite.
There was one nurse in particular that I felt like treated me like nothing I did with my son was right, and she tried not to let me do anything to care for him. When I started figuring out the shifts of the nurses and I knew she was gonna be there, like, sorry. I had to like mentally prepare myself for dealing with her.
And I feel like if they were the doctors and stuff were more open about it, and they made people feel more welcome and didn't, like I say, classify them as soon as they walk in and put the X on their chart and send it away, you know, saying that it would help a lot more people, and in turn it would be a lot better community and world for that matter. Yeah.
I can go back and tell you 20 years ago when I started working at the hospital,
I can see where I failed as a social worker because my training was not so much it was a disease process. It was more like it was a choice and they needed to be reprimanded for their poor choices and the consequences. And the stigma was you're a drug addict and you're never going to change and your babies are going to be born with this.
It's hard to think of a more stigmatized experience than being pregnant and having a substance use disorder. So if you are a postpartum person and you have a newborn, you go to your child's pediatrician over here at this clinic over here. You get your postpartum care from your OB at this clinic over here. Your mental health treatment is almost definitely a separate facility. And that's 3 different medical staffs, that's 3 different front desk folks, that's 3 different providers. And for that patient, it's potentially 3 different opportunities to face stigma, judgment, and fear of legal consequences. And those fears are real.
So when I first found out I was pregnant, the word on the street was you can't go to the doctor. If you go to the doctor and they test you and you're positive, your baby's gonna get taken. This is what I pictured in my head. They were gonna be there like waiting as I'm giving birth to like take the baby away from me.
Like I did. I used to be scared to tell the doctors that I was of my past because I thought they were going to judge me or they were going to look down on me. That I denied the fact that I was pregnant, so I was almost 7 months. So I was really scared to come in and thinking they're going to think I'm like the most horrible person in the world, that I've been neglecting my prenatal care.
We see situations where moms will wait to the last minute and they come in here and either have the baby en route or right after they get here. They're more apt to leave the hospital against medical advice or not want to stay in room in. They just feel hopeless. I mean, they've voiced that to us, that there's no way out.
I think when patients show up with no care to our hospital, we often automatically assume that this is a choice that they've made. We need to really think about how we're talking to these patients and about these patients. I think we're realizing with stigma and bias in general in medicine that it is a continuous educational process and that none of us are perfect and that we have to also be able to call each other out when we have a bad day and we say the wrong thing. Hey, you can't call this patient an addict. We need to talk about what is going on in their environment and how to help them.
When I go in to meet with these mothers, I kind of meet where they're at. Whatever's going on in their life, that's where we're meeting. And it's actually worked so much better because I later see these mothers with their babies. The mothers coming in the hospital. I see the mothers at the local Walmart bringing their babies to me and say, Ms. KK, I want you to see my baby. They see me as on their team, not as the dictator telling them what to do. They see that I was there to try to help them.
It's a medical condition. Just like we would not blame someone for having hypertension, we would treat their hypertension, we would treat them with care, we would treat them with kindness. We have to understand that substance use disorder is also a medical condition and it's not a moral failing.
Being on the buprenorphine at those patients, it's a game changer. It's critical to treatment, is critical to success, short and long term.
That was a godsend, that medicine is. Yeah, I thought it was going to be like I was going to have cravings or the urges to, I thought it was going to be really a lot harder than it was. Yeah, I could be the spokesperson for it because if anybody can stay off of drugs going through what I've gone through, just being on that medicine, I think it's pretty good stuff. You know what I mean?
Suboxone helped save my life. Like, I wouldn't say it was the only thing that saved my life, but without it, I don't feel that I would be here today. I'd probably be dead.
It is a relatively easy thing to do once you've had the training, and it is extremely rewarding to see somebody whose life has turned around, to see what a difference it can make in their lives.
From my very first visit, just to paint like a mental picture, so my first visit, they had brought me from the jail. So I'm in, black and white stripes, handcuffs, orange flip-flops, and I'm already like mentally preparing for the judgment that I'm gonna receive. I was 4 months pregnant at the time, and this doctor walked in, and he had a big old smile, and he was like, "Hi, Miss Rachel, how are you doing?" As if I was just any other patient. That's how he talked to me, and I was so shocked. I mean, it caught me way off guard. I didn't really have a lot of self-esteem, I had zero hope. Like, I accepted that I was gonna die a heroin addict. Like, I had accepted that a long time ago. And they just made me feel human again.
With Rachel, her dad called me and he said, "You saved my daughter's life. Your facility saved my daughter's life." And he was crying. And he said, "We lost her. We lost her for 8 years." He said, "But you gave our daughter back to us." And he said, I want to come to your house. I want to cook supper for you and your family. I want to meet your family." And he came, and they met with my family. And I mean, I can't even describe that interaction and what it means to me and the work we've done. Once you say that one, then you're hooked. You want to save another one.
Now I'm like a mother that has a job and helps other people, and I'm trusted by everyone around me. I mean, I have keys to the church where we do our meeting, okay? Like, if, years ago someone would have told me I would be doing the things I'm doing right now in my life, I would have laughed in their face and been like, no way. Because I had given up on myself, I really had. But there's always hope, I feel.